Now we're going to switch gears and start talking about burns, followed by hypothermia. When a patient presents to you after being rescued from a fire, the best initial therapy is 100% oxygen. This will treat both smoke inhalation and the carbon monoxide poisoning. Remember, airway burn is the second most common cause of death from burns, only if there's been an airway injury. There are only 5 times you should intubate somebody when they've been in a fire. The first is if they have any signs of burning inside the mouth. Second, if they have any burns inside the nasopharynx. Third, if they're having any wheezing. Fourth, if they display any signs of hoarseness. And lastly, if they have audible stridor. If the airway burn is not present, the second most common cause of death is significant volume loss. Remember, fluid replacement is based on the percentage of body surface area burned. The IV fluid of choice for burn patients is Ringer's lactate. If Ringer's lactate is not one of the choices, give normal saline. You give 1/2 in the first 8 hours, 1/4 in the second 8 hours, and 1/4 in the third 8 hours. You give 4 milliliters for each percentage of body surface area burned for each kilogram of body weight. Remember, the head is worth 9%, the arms are 9% each, the legs are 18% each, and the chest or back are 18% each. Patients sometimes have patchy burns that aren't continuous. To assess the percentage of body surface area burned, what you should do is use the width of a patient's hand to make the estimate. Each hand width is worth about 1% of a body surface area. The short answer is always this. You give the largest amount of Ringer's lactate or normal saline listed as an answer choice, because it's usually the right answer. Remember, fluid replacement is equal to 4 milliliters multiplied by the percent body area burned multiplied by the weight in kilograms. What is the most common cause of death several days to weeks after a burn? Is it A, infection, B, renal failure, C, cardiomyopathy, D, lung injury, or E, malnutrition? The correct answer is A, infection. Because of a loss of skin, there is massive loss of body fluids and albumin. Fluid loss, if fatal, will occur immediately. After several days, the loss of the protective barrier of the skin leads to infection with staphylococcus. Renal failure is not the right choice because combined with volume depletion, yes, it does decrease renal perfusion, but rhabdomyolysis will cause renal failure, but is not the most common cause of death. Cardiomyopathy is also not because it's not affected so quickly. It takes some time to develop. Lung injury is the immediate cause of death, and malnutrition doesn't occur that quickly. Fluid loss doesn't always mean malnutrition. The USMLE loves heat disorders. Heat cramps and exhaustion occur when you're exerting yourself and there's a high outside temperature. Heat stroke occurs in the same setting, high outside temperatures and lots of exertion. The body temperature with heat exhaustion is normal. Body temperature with somebody with heat stroke is elevated. CPK and potassium will be normal in heat cramps and exhaustion, but in heat stroke it'll be elevated. The treatment for somebody with heat cramps is oral hydration and electrolyte therapy. In somebody with heat stroke, it's actually IV fluids and evaporative therapy. The next 2 heat disorders present very similarly. The history will be your clue in getting the answer right. To develop neuroleptic malignant syndrome, there will be a history of antipsychotic medication use. For malignant hyperthermia, there will be anesthetic medications that have been administered systemically. Body temperature is going to be elevated in both. CPK and potassium will also be elevated in both. The treatment is dantrolene or some dopamine agonist like bromocriptine or cabergoline for neuroleptic malignant syndrome. For malignant hyperthermia, it's simply dantrolene. When a patient displays hypothermia, look for an intoxicated person. Unintoxicated people do not fall asleep outside in cold temperatures. The most common cause of death for hypothermia is cardiac arrhythmia. Therefore, the best initial test, yeah, that's right, EKG. Now, what you must realize is on the EKG, hypothermia results in marked elevation of the J point. This is not an ST elevation or a right bundle branch block, so don't start activating the cath lab. It's just the J point elevation. After a patient has drowned, you must manage the airway and administer positive pressure ventilation to increase gas exchange. Steroids and antibiotics are not beneficial in drownings. Saltwater drownings, patients present like they have CHF. They have wet, heavy lungs, and gas exchange is very poor. Remember, the wrong answers for drowning are always steroids, and antibiotics. Freshwater drowning causes hemolysis. This is because too much hypotonic fluid is circulating in the vasculature. The RBC will come in contact with this hypotonicity. They will swell and subsequently hemolyze.